at least 2 weeks, constitute a major depression.
Okay, thank you so much. So you can see it's a very difficult to talk about it, a very difficult way of showing these new situations. And well, we have this criteria, 5 or possibly 4 of the above symptoms. We are talking about a major depression, so just for consideration, but it's important to evaluate, to detect, and take in account, because mental health is important. About the types of mood disorders, we have more symptoms: bipolar disorder, seasonal affective disorder, chronic depressive disorder, anxiety disorder, psychotic depression, postpartum depression. So these mood disorders, of course, all have treatment. All of them need an intervention in therapy. Maybe we can get the key of helping someone else. Now we have neurotic and stress-related disorders. Maybe Fernanda, can you listen to me?
Yes, I can.
Yes, can you read these slides, please?
Okay. An example of neurotic disorder is obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with a patient's life. A compulsion is an obsessive idea that forces a patient to act even though they recognize that is unnecessary. A common form of this compulsive washing of the hands. Stress is a feeling of being unable to cope. It can be led to anxiety for fear of problems. A sudden attack of anxiety is called a panic attack.
Thank you so much. Again, you can see in black and words more vocabulary, more expressions to check. Going ahead, more symptoms of neurosis: doubt and confusion, egoistic disturbance, self-consciousness, anger, anxiety, and irritation, feeling of guilt and hostility, fatigue and depression, emotional instability, doubt and confusion, I said, okay? So check this, practice with this, memorize this. Anyway, we don't have no way of talking about it. The common signs of neurosis, we have more. Conflict caused by lack of emotional resilience, codependent, making it know they are stressed to others. They love to talk about the stress. Constant need for validation and reassurance on any matter or issue. Being a perfectionist, losing control of emotions in a serious conversation, right? So let's consider more symptoms. I know it's a lot of information, lots of slides. That's why I was telling you to go ahead with the presentation. The acute stress disorder symptoms: intrusive, dissociative, avoidance, negative mood, arousal. So you have the meaning, check the meaning, practice with this. And the post-traumatic stress disorder diagnosis criteria. We have all of these situations to consider: intrusion, stressor, avoidance, negative in alterations in mood, alterations in arousal or reactivity, duration, functional significance, exclusion. So taking these expressions, the symptoms, the signs, these findings and complaints, we can help our expression, how to write down, okay? Other types of functional disorders, this includes behavioral syndromes associated with psychological disturbance, such as eating disorders. Potential signs of an eating disorder: excessive exercise, preoccupations with feeling fat, abnormal electrolyte levels, intense fear of gaining weight, usually large intake of food, anxiety around or avoidance of eating. And now this slide I like too much, but making again a parenthesis, if we lose again the Zoom session, we are going to come back with the same link. It was supposed not to happen. I'm sorry, but well, coming back, let's get in with the same link, okay? Talking about the disorders of an adult personality and behavior, the personality disorder, properly said, we can compare them with all of the Disney princesses. Why? Because if you check the psychological behavior of each one, you could find a syndrome, and it's not my definition, it's not my conclusion, it's proved by science. And all of them have a way of behavior that can support these ideas. Checking the movies, checking how they act when in the presence of their prince, we can see, for example, Mulan's looking for validation. Just validation. Doesn't matter if she dies or not. Tiana has an obsessive compulsive disorder. She wants to be the chief of everything without measuring the effort, without considering the complete situation, maybe losing the real way of acting. Ariel changed everything for a man that she really didn't meet. She changed her life, family, and everything without considering the consequences. So we have the information for taking this as an idea, and well, taking in account that they are not examples for a healthy mind, but just as a slide for showing information. Talking about mental retardation, delayed mental development, we have a picture with some patients that are obviously with a syndrome that is evolved. And we have this information, this vocabulary showing us that we have 4 colors showing us 4 ideas. For example, number 1 in yellow, experts and authorities agree that mental retardation is a complex condition. Yes, we all know this, correct? Number 2, mental retardation is a developmental disability. Of course, it's a disability. Now we have the mental retardation results in substantial limitations in 3 or more of the major activities of daily life. And then mental retardation encompasses a heterogeneous group of people with varying needs in life contexts. So we can see it's not an easy situation. And well, just as an information slide, as an information picture, considering the vocabulary again and the criteria about talking about mental retardation, okay? Now talking about schizophrenia. Schizophrenia is not an easy situation, and not an easy disorder to consider, because it's like a ray changing all of the life, okay? And there are delusions, false beliefs evolved. The most common symptoms of schizophrenia, the positives, are delusions, hallucinations, disorganized speech, and negative, flattened affect, reduced speech, lack of initiative. So consider this. Again, more vocabulary to consider, more vocabulary to memorize. We are going to stay here in this yellow slide. Please come back to the same link, okay? And then we are going to continue. We are around the half of this presentation. We are going to do it faster.